Linac Synergy, inspiring clinical confidence. Linac Synergy meets today's challenges in precision radiation therapy, internal organ motion, and errors in patient setup. By imaging at time of treatment and in treatment position, Linac Synergy inspires clinical confidence, enabling more effective treatment of tumors, while minimizing damage to surrounding healthy tissue. Linac Synergy is a result of the close collaboration with leading radiation therapy centers around the world. For the first step in the procedure, the patient goes through a planning CT scan. The treatment is then planned, and the data is exported to the Linac Synergy system. The patient is set up and imaged using Linac Synergy, providing 3D volume images at the time of treatment and in treatment position. The images are analyzed at the X-ray volume imaging workstation, XVI. Table corrections are made according to the values presented by XVI. Adjustments can also be performed by changing the treatment plan or changing the beam aperture. The patient will now be treated in the corrected position. The next section of this video will follow a patient being treated at the Netherlands Cancer Institute, Antonie van Leeuwenhoek AVL Hospital in Amsterdam, using Linac Synergy.
There's an assassin lurking inside my body. It must have been there for a while, or it wouldn't be 13 millimeters.
Joost de Mos was diagnosed with lung cancer and needed radiotherapy as soon as possible. The tumor is located on the simulator. The marks on his skin serve as reference points and indicate how Joost should be positioned during the treatment. Radiotherapist José Beldebos will be treating the tumor. Prior to the treatment, she does a CAT scan. Joost will wear a mask to map out his breathing. The radiotherapist needs to know exactly where the tumor is located and how it moves during breathing. Here you see the patient and the blue line. It indicates the position of the scanner and where the images are made. The images have just been produced by the CAT scan, and the tumor appears. The tumor stays fairly still, which will make the radiation therapy easier. Here is the tumor. It's moving a little, but not much. Joost has pulmonary emphysema and has smoked for years. He's been seeing a pulmonologist because of the malfunction of his lungs. The doctors at AVL discuss his treatment. The tumor is sort of round, not very clear, and at least 1 centimeter in size. Not all tumors respond well to radiation. The result cannot be predicted in advance. In conclusion, the patient is a 59-year-old man. His lungs are too weak for an operation, so the team agrees on applying radiation therapy. The radiotherapist is making a treatment plan. First, she draws in the tumor and determines the target area. This is where the patient's skin was marked, which will serve as reference points. Here, the tumor in the right lung is seen. It's enlarged by a margin, and the maximum dose will be directed at this margin. In the past, when the exact position of the tumor wasn't known, a much bigger margin was needed. This meant that the radiated volume was much larger, often including normal tissue. Now, the tumor can be radiated accurately and with a higher dose. This won't affect Joost's lung function too badly, which is important for a patient with emphysema. This is the first in a series of 30 radiation treatments.
Goedemorgen, meneer de Vos. Goedemorgen, Joost. U kunt plaatsnemen op de tafel.
Ik heb er wel vertrouwen in, want
I'm optimistic. The prognosis is good.
daar moet ik...
I'll just have to believe in it, and I'm willing to do that.
Before treatment, a volume view image is acquired. Comparisons can then be made between the original planning scan in order to determine the current size, shape, and location of the tumor. Just is positioned exactly according to the tattoo marks. To acquire the 3D volume view image, Linac Synergy rotates around the patient, capturing data as it goes. During the acquisition, the volume view image is simultaneously reconstructed so that it's ready for viewing and manipulation once the process is completed. Just's scan is ready. The reference scan and the new one are compared. The images are adjusted to match each other, so the position of the tumor is well aligned. In the registration mode, the reference data and the acquired localization volume view images are displayed simultaneously. The XVI software provides the tools to perform registration manually or automatically using a choice of presets. Throughout the registration process and when alignment is complete, the positional error is shown. The positional error is calculated, and resulting corrections are displayed in the table correction panel. Before treatment, the table is moved into the new corrected position. Just treatment can begin. It takes a few minutes. The tumor is radiated from 3 angles to spare the surrounding tissue.
Gaat het?
6 weeks later, the 30 treatment series is finished. Apart from tiredness, Just hasn't had any side effects. Dr. Burgers will tell the couple what effect the treatments have had. This is the very first X-ray, and this is the one taken 6 weeks after treatment. The tumor is clearly smaller. The effect will be monitored over a 5-year period. If it doesn't grow during this time, it's considered to be cured. If it does grow during this period, it needs to be examined. It might mean the tumor is back. But this is a very good start. And this is how it should be.
I'm relieved. I was very nervous. It's good to hear the radiation treatments worked. Let's hope it stays this way.
Positief blijven.